So Metabolon is a health technology company, and we work really on delivering healthcare to patients. And we do this through a very unique technology. It's called metabolomics. So we can take a sample from a person, and that sample would be a blood sample. It doesn't have to be very much blood, and we can measure all the small molecules that comprise metabolism in that individual. And when that gets out of when the metabolites change, that's what leads to a lot of diseases. And so we're able to pick up kind of wellness and monitor wellness, and we're also able to monitor disease. So we can pick up the early stage of chronic diseases like type 2 diabetes or cardiovascular disease, and then we can get into more complicated issues too. And what we're talking about at the conference is things like undiagnosed disease or chronic fatigue syndrome, things like that. So what we do is we get blood samples, typically blood samples. It could be urine, it could be cerebral spinal fluid from a patient. They ship it to us through their physician. We do an analysis on it. We can report back on a couple of thousand molecules. We can fit those into how metabolism works, and we can tell what is actually happening with that particular patient, and then report back. We have to report back to the physician at this point in time because we're a regulated group, and we can't go back straight to consumers. I don't think you're going to see this through standard healthcare for a while, so we have to go through specialty physicians right now, people that are running concierge practices, that run functional medicine practices. It will certainly be in doctors' offices, and we're doing that right now. Pharmacies, there's only one state in the country that you can do that with, and that's Arizona. They're the only ones that have changed the CLIA laws, which govern what we do. We have to get into a very complex disease, for example, an undiagnosed disease patient. Sometimes that's hundreds of dollars, sometimes it's thousands of dollars, because we might have to dig really deep into the data and understand what's happening with the patient. It's a heavily engineered set of laboratory systems. It relies on a technology called mass spectrometry. What we had to develop is about 2.5 million lines of software code to take the very complex data that comes out of these instruments and be able to interpret what we can interpret with that. It was a vast amount of engineering processes. It was a lot of understanding these instrumentation, developing software, developing quality control on the processes. So it's a very engineered, screwed down system. And so we've pulled in software designers, mathematicians, biochemists, engineers, and we just attacked the problem for a long time. We've done 5,000 studies, and we've assembled a database that's really one of a kind in the world, where we looked at diseases. So we've done, for example, in liver disease, we've done 70 studies on liver disease. So we know the markers right now that we need to look at. We have launched various diagnostic products. So we have a test for prediabetes that's on the market. We've tested about 600,000 patients now. We measure what is called insulin resistance, and that's the basic pathology behind type 2 diabetes. We have a test for what's called impaired glucose tolerance, and that is used principally right now on expecting mothers that may have gestational diabetes. Our challenge is actually being able to talk to physicians and explain to them what they need to do to their patients, right? So it's not getting the data, and it's not understanding the data. It's being able to make the communication back to a physician where they can take it in the time frame that they have to work with that patient and actually help that patient out.